Today, we'll explore the findings from groundbreaking research about cancer. It highlights the importance of lifestyle choices for cancer survivors, as well as for people who want to avoid cancers. This study, conducted across multiple countries, reveals how simple changes in daily habits can significantly impact survival rates. Researchers from the United States, the United Kingdom, and China collaborated on this extensive study. They analyzed data from 4 major groups: the National Health and Nutrition Examination Survey or NHANES, the National Health Interview Survey of NHIS, the UK Biobank, and the Kailuan study. The researchers identified 5 key lifestyle factors that play a crucial role in cancer survival. 1. Never smoking or quitting smoking was associated with a significantly lower risk of mortality. 2. Alcohol consumption. Lesser alcohol consumption was linked to better survival rates. 3. Diet. A healthy diet rich in fruits, vegetables, and whole grains was crucial for improving survival. 4. Physical activity. Regular physical activity was found to be beneficial. 5. Body mass index, BMI. Maintaining an optimal BMI was associated with lower mortality. The Healthy Lifestyle Score, a simple guide. To make it easier to understand the impact of these factors, the researchers created a Healthy Lifestyle Score, HLS. This score ranges from 0 to 5, with higher scores indicating better adherence to healthy lifestyle practices. The study found that cancer survivors with higher HLS or healthy lifestyles had significantly lower risks of all-cause and cancer-specific mortality. Among all the lifestyle factors, smoking had the most significant impact on survival. Cancer survivors who never smoked had a 23% lower risk of all-cause mortality compared to those who smoked. This finding underscores the importance of quitting smoking for cancer survivors. Smoking is not just a bad habit, it's a major health hazard that significantly increases the risk of various cancers. In this video, we'll delve into how smoking causes cancer, the types of cancer it can lead to, and why quitting smoking is crucial for both prevention and improving survival rates. The chemicals in cigarettes is a toxic mix. Cigarette smoke contains over 7,000 chemicals, including at least 69 known carcinogens, which are substances that can cause cancer. When you inhale cigarette smoke, these harmful chemicals enter your lungs and spread throughout your body, causing extensive damage. DNA damage is considered the root of the problem. One of the primary ways smoking causes cancer is by damaging the DNA in our cells. DNA controls how our cells grow and function. When harmful chemicals from cigarette smoke damage DNA, they can cause cells to grow uncontrollably, leading to cancer. This damage accumulates over time, increasing the risk of cancer the longer you smoke. Impaired immune system, a double whammy. Smoking also weakens the immune system, making it harder for the body to fight off cancer cells. Poisons in tobacco smoke can hinder the immune system's ability to kill cancer cells, allowing them to grow and spread unchecked. Types of cancer caused by smoking. Lung cancer. Smoking is the most common culprit. Lung cancer is the most well-known cancer caused by smoking. Nearly 9 out of 10 lung cancer deaths are linked to smoking cigarettes or exposure to second-hand smoke. Lung cancer remains the leading cause of cancer-related deaths worldwide. Do you think smoking is only causing lung cancer? It's also a major risk factor for at least 15 other types of cancer, including mouth and throat, esophagus, larynx or voice box, pancreas, bladder, kidney, liver, stomach, cervix, colon and rectum. Acute myeloid leukemia, a type of blood cancer. Emerging evidence shows more risks uncovered. There is growing evidence that smoking may also increase the risk of breast cancer and other types of cancer. The impact of quitting smoking on cancer outcomes. It's never too late. Quitting smoking at any age can significantly reduce the risk of developing cancer and improve survival rates for those already diagnosed. Within 5-10 years, the risk of cancers of the mouth, throat, and voice box drops by half. Within 10 years, the risk of bladder, esophagus, and kidney cancers decreases. Within 15 years, the risk of lung cancer drops by half. Within 20 years, the risk of cancers of the mouth, throat, voice box, and pancreas drops to levels close to those of non-smokers. Improved survival rates is a clear advantage. Studies have shown that lung cancer patients who quit smoking before diagnosis have significantly better survival rates than those who continue to smoke. The longer the period without smoking before diagnosis, the better the odds of survival. This benefit extends to other types of cancer as well, highlighting the importance of quitting smoking as early as possible. Practical tips for quitting smoking. Quitting smoking is challenging, but there are many resources available to help. Speak to your doctor or pharmacist about smoking cessation programs, medications, and support groups. Many organizations offer free resources and support to help you quit smoking for good. Use smoking cessation aids, tools to help you quit. Consider using nicotine replacement therapies, NRTs, such as patches, gum, or lozenges. Prescription medications like varenicline, Chantix, and bupropion, Zyban, can also be effective in reducing cravings and withdrawal symptoms. Create a quit plan. Set yourself up for success. Develop a quit plan that includes setting a quit date, identifying triggers, and finding healthy alternatives to smoking. Having a plan in place can increase your chances of quitting successfully. Stay active, keep your body and mind busy. Engage in regular physical activity to help manage stress and reduce cravings. Exercise can also improve your overall health and well-being, making it easier to stay smoke-free. Seek support, lean on friends and family. Tell your friends and family about your decision to quit smoking and ask for their support. Having a strong support system can make a big difference in your journey to becoming smoke-free. Alcohol, moderation is not key. The old school says light alcohol consumption was associated with a 14% lower risk of mortality. This theory is now debunked. Recent studies have shown that there is no safe level of alcohol consumption when it comes to cancer risk. Here are the key points from the latest research. The International Agency for Research on Cancer, IARC, has classified alcohol as a Group 1 carcinogen, meaning it's a known cause of cancer in humans. Alcohol consumption increases the risk of at least 7 types of cancers, including cancers of the oral cavity, pharynx, larynx, esophagus, colorectal, liver, and female breast. Even light to moderate drinking can increase cancer risk. The World Cancer Research Fund, WCRF, and the American Institute for Cancer Research, AICR, recommend limiting alcohol consumption based on evidence that even small amounts of alcohol increase cancer risk. A 2022 study published in The Lancet Public Health stated, no studies have shown that the potential existence of a protective effect for cardiovascular diseases or type 2 diabetes also reduces the risk of cancer for an individual consumer. The same study emphasized, evidence does not indicate the existence of a particular threshold at which the carcinogenic effects of alcohol start to manifest in the human body. As such, no safe amount of alcohol consumption for cancers and health can be established. A 2021 study published in The Lancet Oncology found that alcohol consumption was linked to more than 740,000 new cancer cases in 2020, which is about 4% of all new cancer cases globally. The U.S. Dietary Guidelines for Americans 2020-2025 state that if alcohol is consumed, it should be in moderation up to 1 drink per day for women and up to 2 drinks per day for men. However, these guidelines are for overall health and are not specific to cancer prevention. Implications for cancer survivors and prevention. For cancer survivors and those looking to reduce their cancer risk, the current evidence suggests there is no known safe level of alcohol consumption for cancer prevention. Even light to moderate drinking can increase cancer risk. For those already diagnosed with cancer, alcohol consumption may interfere with treatment effectiveness and increase the risk of cancer recurrence. The best advice for cancer prevention is to avoid alcohol altogether or to minimize consumption as much as possible. In conclusion, the latest research does not support any protective effect of moderate alcohol consumption against cancer. Instead, it emphasizes that reducing or eliminating alcohol intake is one of the most effective ways to lower cancer risk. Diet, the foundation of health. A healthy diet was found to be one of the most important factors for improving survival. Cancer survivors who followed a healthy diet had a 31% lower risk of mortality. This highlights the importance of consuming a balanced diet rich in nutrients. The WHO has classified processed meat as a Group 1 carcinogen, which means there's strong evidence that it causes cancer, particularly colorectal cancer. Processed meats include ham, bacon, salami, hot dogs, sausages, canned meat. The risk increases with the amount consumed. Studies suggest that every 50-gram portion of processed meat eaten daily increases the risk of colorectal cancer by about 18%. Red meat is also classified as a probable cancer risk. Red meat has been classified as a Group 2A carcinogen by the IARC, meaning it probably causes cancer. This category includes beef, pork, lamb, veal. While the evidence is not as strong as for processed meat, high consumption of red meat is associated with an increased risk of colorectal cancer, as well as pancreatic and prostate cancer. Ultra-processed foods, an emerging concern, soft drinks and artificially sweetened beverages, packaged snacks, pre-prepared frozen meals, sweetened breakfast cereals, high-fat and low-fiber diets. Diets high in fat and low in fiber have been associated with an increased risk of several cancers, including alcohol is also a known carcinogen. While not a food, it's important to note that alcohol consumption is a known risk factor for several types of cancer. The WHO classifies alcoholic beverages as a Group 1 carcinogen. It's important to note that while these dietary factors can influence cancer risk, they are part of a broader picture that includes other lifestyle factors like smoking, physical activity, and environmental exposures. A balanced, varied diet based on whole foods, along with a healthy lifestyle, remains the best approach for cancer prevention. Physical activity, move more, live longer. Regular physical activity was linked to a 10% lower risk of mortality. This finding emphasizes the importance of staying active, even after a cancer diagnosis. Simple activities like walking, swimming, or yoga can make a big difference. Body mass index, finding the balance. Maintaining an optimal BMI was associated with an 11% lower risk of mortality. This means that both underweight and overweight individuals should aim for a healthy weight to improve their chances of survival. The combined effect, greater than the sum of its parts. The study also looked at the combined effect of these lifestyle factors. Cancer survivors who adhered to 4 or 5 healthy lifestyle factors had a significantly lower risk of mortality compared to those who followed fewer healthy practices. This shows that the combined effect of multiple healthy habits is greater than the sum of its parts. Practical tips: how to improve your lifestyle. Now that we understand the importance of these lifestyle factors, let's look at some practical tips for cancer survivors. Quit smoking, seek support from healthcare providers, join a support group, or use smoking cessation aids. Moderate alcohol intake, limit alcohol consumption to light or moderate levels. Eat a healthy diet, focus on whole foods like fruits, vegetables, whole grains, lean proteins, and healthy fats. Stay active, incorporate regular physical activity into your daily routine. Aim for at least 150 minutes of moderate exercise per week. Maintain a healthy weight, work with a healthcare provider to achieve and maintain a healthy BMI. In conclusion, this multinational study provides compelling evidence that a healthy lifestyle can significantly improve survival rates for cancer survivors. By making small, manageable changes in daily habits, cancer survivors can enhance their quality of life and increase their chances of long-term survival. Thank you for watching. We hope this video has inspired you to take charge of your health and make positive changes. Remember, it's never too late to start living a healthier life. Stay tuned for more informative videos on health and wellness.